Last month, the World Health Organization announced an emergency immunization campaign of 74 million children across Africa after warning that polio had reappeared in 10 African countries. Polio, which mainly affects children under the age of 5, is caused by a virus that invades the nervous system and can cause total paralysis or death. The disease is considered endemic in only 6 countries: Afghanistan, Egypt, India, Nigeria, and Pakistan. When the eradication drive was launched in 1988, polio was a serious problem in 125 countries.
In Africa, we look at Nigeria, Niger, and Egypt, but Nigeria is clearly what you may call the epicenter of polio epidemic in Africa.
There are 2 forms of polio: wild polio and vaccine-derived form. Wild polio can be prevented with a 3-dose oral vaccine that contains an altered live form of the polio virus. Sometimes the virus reactivates inside the body and then gets into the environment through human feces. Once it's in contact with the water supply, the polio virus reverts to a wild stream and is able to spread. Experts on polio focus on immunization as a deterrent against this disease, of which a cure has not been found yet.
I'm sure you are aware that there are 2 types of immunization. One is the inactivated injectable type of polio immunization, and the other one is the oral vaccination program, which is widely used for a number of reasons.
Dr. Akukwe attributes the lack of communication in some countries as one of the reasons polio has escalated. Many families have chosen not to vaccinate their children against polio because they have not been educated on the importance or because of unfounded fears of side effects from the vaccine. This factor has led to some countries seeing a rise in polio cases.
Where you have miscommunication or where people are afraid of the potential side effects of a vaccination program, parents will elect not to have their kids vaccinated. And we've seen how such miscommunication could have very devastating effects, because in the last 2 years, countries that have been certified free of polio are now coming down with 1 or 2 cases of polio, what they call importation countries.
One of the challenges that lies ahead in this campaign is to educate families in endemic countries to dispel certain misconceptions that exist about polio.
I see that in Nigeria, from what I have read and from agency reports, that the Kano government is now, Kano state government and other governments in far north Nigeria are now cooperating with the federal government.
Conflict is also one of the factors that has led to a rise in new polio cases. The crisis in Sudan's Darfur region has played a part in spreading the disease across borders. According to the World Health Organization, it is said Sudan had been polio-free since April 2001, but cross-border movement between Chad and Sudan had reintroduced the virus.
The Darfur region now is showing, they are beginning to record cases of polio, and even all the way to Khartoum.
While it is too early to determine precise coverage attained during the immunization campaigns, indicators have pointed to a successful implementation so far. Several countries across West Africa have reported reaching 90% of their target population. In total, the effort has involved more than 40 million volunteers, a sign that people may have finally woken up to the challenge ahead.